History is full of small decisions that spiral into chaos. Sometimes the tiniest missteps or overlooked details can set off a chain reaction that no one could have predicted. In the world of politics and global affairs, these moments are everywhere, hidden in the background, waiting to explode. Take Sarajevo, for example. A single wrong turn by a driver in 1914 put Archduke Franz Ferdinand in the path of an assassin. And that one mistake ignited World War I, changing the course of history forever. Or consider the Watergate scandal. A simple piece of tape on a door meant to keep it from locking ended up unraveling an entire presidency and shaking the foundations of American politics. That's the butterfly effect in action. Tiny, seemingly insignificant actions that lead to massive, world-altering consequences. Like dominoes falling, one event triggers another, and the ripples spread far and wide. In international politics, few things trigger chaos quite like a sudden shift in economic policy. When leaders make bold moves, especially on trade and tariffs, the effects can be felt across continents, shaking up markets and alliances overnight. Enter the Trump administration's dramatic decision: a 50% tariff slapped on Indian goods. It was a move that sent shockwaves through the global economy and left both allies and rivals scrambling to respond. The move was classic Trump, bold, aggressive, and laser-focused on his America First agenda. It was designed to protect American industries, but it also risked alienating key partners. But buried deep in the long, complicated list of targeted items was a ticking time bomb, one that most people missed at first. Among the goods facing tariffs were crucial Indian pharmaceuticals, a lifeline for millions of Americans. India, often called the world's pharmacy and a key U.S. ally, suddenly found itself treated as an adversary. The diplomatic fallout was immediate, and tensions began to rise between the two nations. As anger grew in New Delhi, Indian leaders started plotting a response. Their plan? To strike back where it would hurt America the most, its vital supply of affordable medicines. The stage was set for a showdown with global consequences. For Indian exporters, the 50% tariff was a nightmare. Overnight, American orders vanished, factories stalled, and panic spread. Industry leaders called the tariffs arbitrary and warned Americans would pay higher prices. Years of trust and partnership with the U.S. were shattered in an instant. The Modi government, blindsided and under pressure, couldn't just take the hit. The opposition accused them of weakness. The public demanded action. India needed leverage, and it had it. Pharmaceuticals, the one industry where India held all the cards. The government began to consider a drastic move, restricting exports of essential medicines. The stage was set for a showdown that could threaten American healthcare. India isn't called the pharmacy of the world for nothing. Over the past few decades, the country has quietly built a pharmaceutical empire, with sprawling factories and bustling labs that churn out medicines at a scale few can match. Today, India produces over 20% of the world's generic drugs, affordable medicines that keep millions, if not billions, alive. These generics are the backbone of healthcare systems everywhere, from rural clinics in Africa to major hospitals in the United States and Europe. From life-saving antibiotics to advanced cancer treatments, chances are high that the pills in your medicine cabinet originated in India. The country's pharmaceutical exports reach over 200 nations, making it a lifeline for patients and healthcare providers worldwide. This pharmaceutical dominance gave India unique leverage on the global stage. Unlike other manufacturing sectors, medicine is not just a commodity, it's a necessity. So instead of retaliating with tariffs during trade disputes, India could threaten to halt medicine exports, a move that would send shockwaves through global health systems. The message was clear: cripple our economy, and will cripple your access to medicine. It was a bold stance, one that underscored just how much the world depends on Indian pharmaceuticals. Indian officials even floated the idea of an export ban on key drug ingredients, a threat that instantly grabbed international headlines and rattled markets. The world watched in shock as what started as a trade dispute quickly morphed into a potential global health crisis. Suddenly, the stakes were higher than ever. In that moment, it became clear: global power wasn't just about GDP or military might anymore. It was about who could supply the pills that save lives, and who controlled the flow of these essential medicines. India was ready to flex its pharmaceutical muscle, showing the world that its factories and scientists were just as powerful as any army or economic policy. And as the US braced for potential shortages, it was about to feel the consequences of relying so heavily on a single nation for its most vital medicines. Most Americans don't know where their medicine comes from. When you pick up a prescription at your local pharmacy, it's easy to assume it was made somewhere nearby, or at least within the United States. But the reality is far more global, and far more complicated than most people realize. Nearly half of all generic drugs in the US are made in India. In fact, India has become known as the pharmacy of the world, producing billions of pills that end up in American homes every year. This includes not just basics like ibuprofen and allergy medications, but also life-saving drugs for heart disease, cancer, and other chronic conditions that millions depend on daily. Medicines for diabetes, antibiotics for infections, and even critical treatments for rare diseases are all part of this global supply chain. The US began outsourcing drug manufacturing to India decades ago, seeking to cut costs and increase efficiency. Over time, this shift allowed American companies to offer affordable medications, but it also meant giving up control over the supply chain. But that created a huge vulnerability. If something disrupts the flow of medicines from India, Americans could face shortages almost overnight. Rebuilding domestic production would take years and billions of dollars. It's not just about building factories, it's about training workers, sourcing materials, and meeting strict safety standards. Even then, the US would still rely on other countries like China for raw ingredients and chemical components essential to making these drugs. If India turned off the tap, US medicine supplies would collapse in weeks, shelves would go bare, pharmacies would struggle to fill prescriptions, and millions of lives would be at risk. Patients with chronic illnesses, the elderly, and children would be especially vulnerable. The US had traded resilience for efficiency, and now the cost was coming due. The system that once seemed so efficient now looks dangerously fragile. The medicine cabinet was suddenly a national security issue. Policymakers are now scrambling to find solutions, realizing that access to medicine is as critical as access to energy or food. And the clock was ticking. The question now is, can the US rebuild its pharmaceutical independence before the next crisis hits? When India's threat became real, panic hit Washington. Officials who'd pushed tariffs now faced a looming health crisis. Emergency meetings erupted across government agencies. Analysts warned drug shortages could hit in weeks if India followed through. Publicly, officials downplayed the threat. Privately, they scrambled for alternatives. No other country could match India's capacity or low prices. Ideas like invoking the Defense Production Act surfaced, but logistics were a nightmare. Even forced domestic production needed foreign ingredients. Hospitals, drug companies, and doctors sounded the alarm. A supply disruption would be catastrophic. Rationing, impossible choices, and real danger loomed. The tariff, meant as a show of strength, had backfired spectacularly. America's medicine supply was suddenly its Achilles heel. From India's view, threatening drug exports was self-defense. Modi's government called it a matter of sovereignty. India wouldn't be bullied. Experts and the public rallied behind the tough stance, seeing it as India's moment to assert global power. For many, it was a point of national pride. In the US, the reaction was panic and outrage. Lawmakers who'd cheered tariffs now scrambled to distance themselves. Democrats blasted the administration for risking lives over politics. Health experts warned this was no game, millions depended on Indian medicines. Even a short disruption could mean hospitalizations and deaths. The public watched, anxious and powerless, as politicians played with their health. The crisis united Americans in dread, cutting across party lines. The stakes had never been clearer. The US-India standoff sent shockwaves worldwide. Countries everywhere realized their own dependence on Indian generics. Health ministers scrambled for assurances. The WHO urged calm. The crisis exposed the fragility of the global medicine supply chain. India's leverage was now undeniable, but so was the risk. Threatening to withhold medicine could damage India's reputation as a responsible supplier. Other nations might seek alternatives even at higher costs. India had to balance strength with responsibility. The world saw that in a globalized economy, medicine could be weaponized. The pharmacy of the world was now a superpower and a potential threat. In India, the public cheered the government's hardline response. Many saw it as standing up to American bullying. News channels celebrated India's pharmaceutical power. The situation drew comparisons to Russia's use of gas as a geopolitical weapon. Economic interdependence, once seen as stabilizing, was now a source of vulnerability. Every trade relationship became a potential point of leverage. Trust in global trade was eroding. India's move was hailed at home, but it sent a warning to the world. In a connected economy, your strength can be someone else's weakness. The line between trade and weapon had never been thinner. Was the Trump tariff a bold move or a reckless gamble? The goal, protecting American jobs, was reasonable, but targeting the world's pharmacy without a backup plan was a blunder. The administration failed to anticipate India's obvious countermove. This wasn't strategy, it was short-sightedness. The crisis revealed the dark side of globalization. Interdependence creates vulnerabilities. Supply chains that bring cheap goods can also be used as weapons. One impulsive decision nearly spiraled into a global health crisis. When the stakes are life-saving medicine, the line between genius and recklessness is razor thin. In this game, the house, and the pharmacy, almost always wins.